Are you worried about your medication costs in 2025? What if I told you, even though the cost of your prescriptions are actually going up, they're ultimately going to be going down? In this video, we're going to talk about how Medicare Part D works, how to make sure your prescriptions are covered, what the new $2,000 out-of-pocket maximum means for you. Plus, if you stick around to the end, we're going to give you a bonus tip on a new program called the M3P program for 2025. Hello, my name is Edwin John Rodriguez, your health insurance representative. And on this channel, we discuss health insurance with a focus on Medicare and ACA plans. As your insurance representative, I get to help you shop and compare your plan options based on your specific needs. The best part is using an insurance broker. Our help is completely free to you. Using an insurance broker doesn't change your plan options or your costs. So if you need help with your health insurance, consider giving us a call and see why my clients consider me their 5-star resource. All right, let's get into it. So the first question is, what is Medicare Part D? Well, Medicare Part D is prescription drug coverage through the Medicare program. Now, there's two ways you can actually get your prescription drug plan. The first is going to be with a standalone prescription drug plan. So if you have standard Medicare or if you have Medicare and a supplement policy, in order to get a prescription drug plan, you have to buy a standalone policy in addition to those first two plans. The other way to get prescription drug coverage is through what we call a Medicare Advantage plan, where it ties your medical and your drug coverage all into one policy. Every prescription drug plan is standardized across the board as far as classifications of medications that are required to be covered, but which medications specifically are covered do change drastically from one plan to the next. Which brings me to my next point, which is, how do I know my medications are covered? Well, insurance companies have a list of medications that are covered on a plan, commonly known as the drug formulary. By using the formulary, it will actually correspond your medication name to a tier level. And with the tier level, will determine what your actual copayment or coinsurance might be for that specific medication. The higher the tier level, the higher the price, generally speaking. Most drug plans are built on a 5-tier drug system, starting as low as tier 1 and going as high as tier 5, with, again, the tier 5 medications being your most costly drugs. Next is going to be, what are my costs related to Part D drug plans? Assuming we're talking about a standalone prescription drug plan, first you're going to have your monthly premium. And that's the amount that you pay every month to actually have the drug program. Think of this as like a membership for having that drug program. Second is you're going to have your deductible. A lot of Part D drug plans will have a deductible built into the policy. So you're going to have to meet that deductible first before they're going to cover more costly medications like drugs that are tiers 3 or higher. Next is going to be your copayments or coinsurance. So again, depending on the tier level of your medication will correspond to how much you're actually going to pay for a specific medication. With your tier 1 or tier 2 drugs being right around $0 to $5 and your tier 5 medication being as much as 25% coinsurance. Next is a new cap for 2025. Starting in 2025, prescription drug policies are going to have an annual maximum of $2,000 that you, the consumer, can spend in the calendar year towards your prescription medications. The costs that go towards your cap of $2,000 is going to be anything you pay out of pocket towards your deductible, anything you pay out of pocket towards your medications itself between copayments and coinsurance. All of these amounts go towards your total for the year of the $2,000. Everything except for your premium, of course. Also new for 2025 is the donut hole. You might have heard in the past a term called the donut hole. And that limit was more so as far as what the insurance company is willing to spend on medications in the year before you fell into this gap. Now that limit is how much you actually spend. So it's more of a safety net now moving forward of $2,000 in the year for the most that you would ever spend in the year for prescription medication. Now, I recommend shopping your drug plans on an annual basis because if you have a standalone prescription drug plan, the plans change drastically from year to year. In September of every year, you're going to receive a document in the mail called an annual notice of change. And what that will do is actually tell you what changes are taking place with your program for this year versus what your drug plan is going to look like for next year. And it will actually highlight those changes. And a lot of times they'll actually tell you what your medications specifically that are going to be affected by those changes. So remember, the smart move is to make sure you're checking your drug plan every fall between October 15th and December 7th. That's a time where you can actually make a change to your drug plan should you need to. And as promised, I have a bonus tip for you. So $2,000 is the annual maximum as far as what you can spend in the year towards prescription medications. Some clients have very costly drugs. So between their deductible and maybe a coinsurance of a certain percentage, they can be coming out hundreds to thousands of dollars in just the first quarter of the year. So yes, you're going to be capped out at that $2,000 in that first quarter of the year. But what if you don't have the $2,000 to fork out, or what you just don't want to pay all that money right up front? So your bonus tip for today is this new program for 2025 called the M3P program, also referred to as the Medicare Payment Prescription Plan. With this program, what it will do is actually allow you to be able to break down your medication costs for the duration of the 12 months. So rather than being front loaded on all of your prescription costs earlier in the year, you can actually break down that prescription cost for the year of that $2,000 divided equally by 12 months to about $167 per month. People love this option because it actually takes the sting out of the extra cost front loaded for your prescription medications earlier in the year. But please make a note that this is not an automatic program. It's something you actually have to opt into by contacting your insurance company. If you call the phone number on the back of your ID card, you can let your insurance company know that you're interested in the M3P program and you want to enroll into it. Now, whether you have a standalone drug plan or a Medicare Advantage plan, you can contact your insurance company and let them know you want to enroll in this program to help moderate the cost of your medications for the year. If you found this information helpful, please remember to like and subscribe to the channel. Medicare is always changing, and staying up to date on changes related to Medicare is the best way to make sure you're getting the most out of your Medicare benefits. Additionally, if you're looking for more of a personalized guidance shopping your insurance, you're welcome to schedule a call with myself or my teammates in order to help you with your health insurance endeavors. And that, ladies and gentlemen, is Medicare Part D explained in a nutshell for 2025. If you'd like more information on Medicare Advantage plans or standalone supplement policies, consider watching this video here, and we'll see you on the other side.